Alright, now we're going to look at some of these motions at each joint that are a little different to think about. So at the foot we have eversion and inversion. I'm not going to stick my foot up here because that's a little weird, but our hand makes a decent foot. So with our hand in this position, there we go. This is our neutral position. You can plantar flex, pushing down, so planting and pushing off. Dorsiflex then would be coming up. Think dorsi is top. When you're going up towards the top, that's dorsiflexion of the foot. Then you have eversion and inversion. So eversion is out and inversion is in. So in and out. Those are our foot motions. If you want to look at pronation and supination, those are combination movements. Pronation is dorsi, eversion, and abduction, so you get that toe out position, and supination is the opposite of that. Alright? At the radio-ulnar joints, we have pronation and supination. Typical way of remembering it, supinated position, you can hold a cup of soup. Pronated, it falls on the floor. So pronated is palm down, everything falls out of your hand. Supinated is palm up, you can hold the cup of soup without burning yourself. At the shoulder girdle, okay, these are your shoulder girdles. These are very important tools in our class. Alright, so let's get up close. We have depression, shoulder girdles go down. Okay, they are depressed, they go down. Elevation is the opposite, they move up. Alright? Protraction is abduction, and it's forward movement of the shoulder girdle in the horizontal plane away from the spine. So basically they do this. They move out away from this spinal column. If you give yourself a hug, you can feel them moving out. Retraction is moving back in, so if you open up like you're doing a chest press or something, you get the retraction or an adduction. Then you also get rotation downward, which is when the inferior angle of the scapula moves medial or downly. You get this as a return from upward rotation, and it's this kind of thing. Then rotation upward is moving outward, so rotation down and up. There are good pictures in your book of this. The ones for the shoulder girdle are on page 23. So upward rotation you get with the arms up, downward rotation you get it with the arms down with the shoulder movements. In the shoulder itself we have horizontal AB and adduction, which is our bench press position. Horizontal abduction is coming forward. You also hear that called horizontal flexion sometimes. Horizontal abduction coming back, so adduction and abduction. You also get scaption, which is just this 45 angle arm raises, the Y's if you've done a lot of shoulder rehab. In the spine we have lateral flexion, which is our side bending, and reduction, which is return of the spinal column in the frontal plane from flexion. So we have lateral flexion and then reduction coming with it. Okay, so that's through that. Then we get to the hand and wrist, and things get really crazy. This is where students have a lot of problems with it. Remember, this part of the class we're getting a general idea. When we get to the hand and wrist, we'll cover it in a lot more detail. So dorsiflexion of the hand and wrist, extension in the sagittal plane, posterior side of the hand moving towards the posterior side of the forearm. Often just hear this called wrist extension going out. Then plantar flexion coming forward. Again, typically you're just going to hear that called flexion. Radial flexion and ulnar flexion. I almost always call these radial and ulnar deviation. So you have our hand, remember pinky side is the ulna because you have PU. So ulnar deviation is pinky towards the ulna. Then thumb is your radial deviation with your thumb moving towards the radius. Then we have opposition of the thumb, which is the diagonal movement of the thumb across the palmar surface to touch your fingers. So opposition. And then reposition is the diagonal movement of the thumb returning to anatomical. So those are our joint specific movements. There's a lot of them. We just introduce them here so it's not as much to handle as we go through each one. Also remember, in your book there are all of the movement icons to help you reinforce this material throughout the book. Make sure that you review those and familiarize yourself. They also give you specific movements to do to help reinforce what's going on. So that is the kind of specialized joint movements, and you can jump back to integrity now.